Welcome to ICOI's Silver Anniversary Celebration, World Congress 17, Implantology at the Crossroads. This meeting was held in beautiful Vancouver, British Columbia on August 15th through the 18th, 1997. This is videotape number 34, Solutions for Upper Posterior Compromised Cases, and Implantology 2000, One Implant per Root Lost. The following video was recorded live at the conference and produced by the Sound of Knowledge Incorporated.
Our next speaker, Dr. Eduardo Tope, hails from Mexico. He is an ICOI diplomate and a professor at the Implantologia Oral in the Pacific area. Dr. Tope will be addressing the Implantology 2000, One Implant per Root Loss. Please welcome Dr. Tope.
Good afternoon, dear college. Thanks for coming. I hope you enjoyed my presentation. In memorial time, man has been trying to replace his lost teeth. But the first evidence of the use of implants was found in the year 600 after Christ in the Mayan civilization in Mexico. This piece of mandible shows us implants made with fragments of shell carved to give the form of three lower incisors which were found in their place with evidence of being in the mouth virtually intact, with osseointegration and without infection or reaction to a strange body. This is proof in the cranium found in the zone of Palenque, Mexico. Since that time, men dreamed with the realization of their first individual implants. In 1981, I made this kind of implants. In 1991, I realized my dream, putting one implant in each lost root. And this is my case of 27 implants in a total rehabilitation using the ECVOS implant system. We put one immediate implant where the second bicuspid was extracted. We filled the socket with synthetic bone and tetracycline. We use the laser application again. We cement provisionals, and it's not necessary to use provisional in the posterior areas. The patient goes home with teeth, and after we check the occlusion. And this is a view of the lower arch when we finished. And you can see the bicuspid crown and the immediate PIT-EC implant in 1991. And this is the final restoration and the last photograph taken in November of 1995, almost 6 years without problems. After we put the upper post, trying again to get the best parallelism, and that's a close-up. And this is the upper and lower final restoration. And do you not agree that the aesthetic factor is very important for our patients? 28 individual teeth come out looking infinitely better than two bridges in which all the teeth have been united. The patient will feel as he has his own teeth again, and he will live giving thanks to you for the rest of his life. That's my clinic in Mexico. And now I'm going to show you some cases where I think it will be better if we use two implants instead of one immediate implant in molar extractions. This is a colleague who is president of the College of Dental Surgeons of Guadalajara and national vice president of the Society of General Dentists. He wants me to pull out his fractured root and replace them for immediate implants, as you can see on the right. And here you can see the beautiful and healthy tissues. On the right, the posts are ready for the crown. This is the crown made with a new material called Arglass. Another case of a fractured root in a patient who was 24 years old. This is the holes of the extraction and the first immediate implant. The second implant in progress and twin implants in place. This is a close-up with the healing screw on the right, the beginning of the bone reconstruction. Feeling around the first and the second implant with artificial bone. Here we have an X-ray after 2 weeks. You will notice that there is still a space between implants and bone. On the right, after 3 months have passed, because of the laser, we can see twin post and the effective healing. In this case, we use 2 different easy posts. One with a screw inside and the other with a screw integrate to the post. On the right, we know the occlusal aspect of the crown. And this is the crown with 2 holes for the twin post. On the right, the crown in the mouth. The X-rays with the crown in place, and on the right, 2 implants on the maxillar, one vestibular and the other palatal to the sinus. This is a molar of a mammoth, and you can see that the roots are shorter than the crown, but nature gave this molar 12 small roots. Why cannot we copy human nature, replacing his 3 roots to the upper molars, especially in cases like this, or this, where we have only a few millimeters of spongy bone? We must use 3 implants like the nature does. And this is the X-ray with the 3 implants for the first upper molar. And on the right, we use a technique where we push artificial bone into the maxillar sinus through the channel made by the implant. This artificial bone leaves the sinus, and we insert the PET-easy implants in the same operation. We don't have to wait. And this is the crown with 3 holes for the 3 posts and the occlusal aspect of the crown. And this is the crown in the mouth. And before criticizing the use of 2 or 3 implants in the molar zone, we must keep in mind that each of the first and second upper molars receive a muscle weight of 44 kilograms. The first and second lower molars receive approximately 31 kilograms. And the central incisors each receive 15 and 16 kilograms. This demonstrates why nature gave 3, 2, and 1 roots proportional to the amount of weight they receive. I invite you to be conscious of these factors in order to ensure the best possible security to your patients in the year 2000 and later on. In the name of the Mexican College of Oral Implantology, thank you very much for your friendly invitation. Thank you very much.
Welcome to ICOI's Silver Anniversary Celebration, World Congress 17, Implantology at the Crossroads. This meeting was held in beautiful Vancouver, British Columbia on August 15th through the 18th, 1997. This is videotape number 34, Solutions for Upper Posterior Compromised Cases, and Implantology 2000, 1 implant per root lost. The following video was recorded live at the conference and produced by the Sound of Knowledge Incorporated.